Ms. Gazan, please, for 6 minutes.
Thank you so much, Chair, and thank you, Minister, for being with us today. Canada lost over 22,000 people as a result of the pandemic. 16,000 of those Canadians who lost their lives, were almost 16,000, were seniors. Mm-hmm. And we know that many more experienced hospitalization and severe symptoms. Clearly, the pandemic has demonstrated how seniors in our society are treated as disposable, particularly relating to long-term care, where we saw the worst of the worst conditions for seniors. I know your government voted against our motion today to put in national standards for long-term care. I know you just responded to my colleague. But Canada, if you look historically, if you look at the universal health care, that's a prime example where the federal government worked with the provinces in the area of their jurisdiction to ensure universal access to world-class health care. I would say that given the conditions, given knowing that seniors are highly at risk, their safety, their ability to live in dignity is at risk by being forced to continue to reside in long-term, for-profit long-term care, certainly speaks to the need for change. And don't you believe, I know your government voted against, but don't you believe that principles of long-term care should be the same as universal health care to ensure seniors are safe and can live in dignity?
Thank you very much for the question. And the tragedy that we saw in long-term care through the pandemic, both in the first wave and then again in the second wave, really points to the need for an improvement in the care of our seniors, especially in long-term care. And so this is why we have reconfirmed that we are moving forward on long-term care standards, national standards, but that we'll be working with the provinces and territories to do that because it is their jurisdiction. And as I mentioned before, we have not just been standing by, we have been investing in long-term care. $740 million was provided to the provinces and territories to bring in control and prevent infections, and that was including long-term care. We announced a $1 billion, as you know, in the fall economic statement to create safe long-term care fund, and we've also funded a long-term care plus.
Unfortunately, it was a little bit too late because almost 16,000 seniors lost their lives, and many others were at risk of losing their lives. And I don't really have a lot of trust around the fast action. I'll give you a couple of examples. Universal pharmacare. The Liberal government has promised this since 1997. We're talking about now, working with provinces and territories to put in place national standards for long-term care. Meanwhile, we know that seniors continue, and not just seniors, also many disabled adults continue to be placed at risk. Well, governments dilly-dally on the backs of seniors and disabled persons in this country. And we know, especially when it comes for-profit long-term care facilities, study after study, report after report confirm that for-profit facilities and their abhorrent services are to blame for the countless deaths and infections related to COVID-19. This is unacceptable to me that we continue to dilly-dally. Shouldn't the federal government move beyond standards and create a national long-term care program to protect seniors and disabled persons and ensure they get the care they need? Would you agree with that?
You will see no argument here on the need for national standards on long-term care, and I can assure you there's no dilly-dallying. I have been having those conversations with my counterparts in the provinces and territories, as has Minister Haidu. So we are underway in terms of having those discussions. We are also making investments through the Long-Term Care Plus initiative, where we are having a sharing of information through the long-term care with each other, with experts, to make sure that they're bringing into place best practices to protect seniors. And we are really happy that NACI, the National Advisory Council on Immunization, has identified that seniors living in long-term care would be some of the first that would get vaccinated, and we can see provinces and territories well underway in that initiative to make sure that we have them protected.
Just finally, is your government willing to immediately end for-profit long-term care? Yes or no?
As I mentioned before, the long-term care is in the jurisdiction of the provinces and territories. So we'll be working with the provinces and territories to bring in national standards, because what's most important is that no matter in what configuration and institution that seniors are in, they need to be safe and they need to be respected, and that's what we were bringing in.
Minister, what is the projected timeline that the national standards will be completed and we will put an end to long-term profit and long-term care? What is the timeline? When is this
brief answer, if you can, Minister, please.
It is in work, currently in work, and we should be having more information on that soon. Thank you.
Thank you, Minister. Thank you, Ms. Gazan. Next.